As we said previously, the blood inside the brain may affect the ICP or the level of the ICP. The second factor is the cerebral edema. As in the case of contusion كدمة للدماغ تنتج عن falling down أو RTA, brain tumor, antidiuretic hormone release, fluid retention, alteration in the blood-brain barrier, protein leaks causing water to flow, and this may increase the intracranial pressure. So that the accumulation of the fluid inside the brain, which is called cerebral edema, and this uh, fluid accumulate on the brain tissues, leading to increase on ICP. The third factor is the hypoxia. Decreasing the PaO2 less than 60 mm mercury may increase the cerebral blood flow and thus increasing the intracranial pressure. Also, other factors like intra-abdominal pressure, increasing intrathoracic pressure, positive end expiratory pressure increase. All of these factors increase the intracranial pressure. PEEP increase the intrathoracic pressure, so that increasing the intracranial pressure. So cerebral blood volume, cerebral edema, hypoxia, increased intra-abdominal intrathoracic pressure may lead to increase in intracranial pressure. Sign and symptom for increased ICP. The first one is the Cushing triad, and these Cushing triad may occur at the advanced stage, in which considered as a classical syndrome of increased ICP, increase in pulse pressure, decreased heart rate, and change in respiratory pattern. Second symptom is the cerebral edema, expansion of the brain tissue within closed space of the skull, leading to increase in ICP. Management: we can provide the patient with corticosteroid and osmotic diuretic in order to decrease the amount of the fluid inside the brain, so that decreasing the ICP. Other signs and symptoms like lethargy, slowing of speech, and delay response to verbal command. Early indicator of increasing ICP is the decreasing level of consciousness. That may end with loss of consciousness, confusion, drowsiness, decortication, decerebration, and flaccidity. The cerebral response to increased ICP may include compensation. Brain components are able to alter their volume to allow for the expanding volume of brain tissue, but the map should be not less than 70 and the ICP should be within 10 millimeter mercury, so that we are keeping the cerebral perfusion pressure up to 60 millimeter mercury or not less than 60. As we said previously, if the cerebral perfusion pressure is less than 40 millimeter mercury, the autoregulation will not work, no dilation, no vessel dilation or constriction, so that the ICP may increase in response to any change in the systemic arterial blood pressure. The decompensations may start at certain volume, in which there is increase on these volume, no compensation, the compensation are exhausted, so that there is increase in the ICP and the decompensation begin. In addition, mental status deterioration, coma, and brain death. Wide pulse pressure, as we said, and bradycardia, the classical signs of Cushing triad. Wide pulse pressure or increasing pulse pressure, decreasing heart rate, bradycardia, and respiratory irregularity. Herniation, shifting of the brain tissue from the area of high pressure to area of low pressure, interfering with the blood supply to that area, causing hypoxia, and may terminate or cut the blood supply to the medulla. So that the complications for increasing ICP including brainstem herniation, diabetes insipidus, and decreasing releasing of antidiuretic hormone, so that the urine output increase as in diabetes insipidus, increased releasing of antidiuretic hormone that may lead to retention of the fluid as in case of syndrome of inappropriate antidiuretic hormone. So that the antidiuretic hormone may be either decreased or increased. ICP monitoring is a critical factor in order to guide the therapy. نوجه العلاج، نعرف شو العلاج، تأثير العلاج على الاي سي بي. ICP monitoring is needed among patients with a brain injury, stroke, and tumor. and among patients who is comatose and the glaucoma scale 3 to 8 with severe brain injury. The decision to use ICP monitoring should be based on the clinical and radiographic evaluation as well as the CT scan. ICP monitoring also should be conducted for patients with brain injury who with normal CT scan واللي عنده واحد من هاي الكرايتيريا 2 or more of these criteria: age more than 40, motor posturing, or systolic blood pressure أقل من 90 ملم mercury. إذا كل هاي الكونديشن اللي ذكرناها تحتاج إلى ICP. لحد الآن صرنا ذاكرين 4 نقط. النقطة الخامسة: non-traumatic neurological disorder that benefit ICP included subarachnoid hemorrhage, intracerebral hemorrhage, tertiary ischemic infarction, infection, hydrocephalus, and rarely brain tumor with associated edema.